people. Today I'm reading the tables of the chapter 132 upon the acute myeloid leukemia, written by the author mentioned in the other video, and the figures. And so, starting from the first table of this chapter, that is table 132 tract 1, or wherever organization, classification of acute myeloid leukemia, and related neoplasms. A. From S.H. Schwerdorf et al. Its whatever organization, classification of tumors of hematopoietic and lymphoid tissue. Lyon, IARC Press, 2008. Acute myeloid leukemia with recurrent genetic abnormalities. Acute myeloid leukemia with translocation 8, 20, Q22, Q22, RAN-X1, RAN-X1T1B. Diagnosis is acute myeloid leukemia regardless of blast count. Acute myeloid leukemia with inversion 16 PL3.1 Q22 or T1616 P13.1 Q22 CBFBMYH1B. Diagnosis in acute myeloid leukemia regardless of blast count. Acute promyelocytic leukemia with translocation 1517 Q22 Q20 promyelocytic leukemia rara B. Diagnosis is acute myeloid leukemia regardless of blast count. Acute myeloid leukemia with translocation 911 PQ22 Q23 MLLT3 MLL. Acute myeloid leukemia with translocation 69 P23 Q34. Def NAP 214. Acute myeloid leukemia with inversion 3 Q21 Q26 2 or translocation 3 Q21 Q26.2 RPN1 A1. Acute myeloid leukemia megakaryoblasttic with T122 P13 Q13 RBM1 15 MKL1 provisional entity. Acute myeloid leukemia with mutated NPM1 provisional entity. Acute myeloid leukemia with mutated CEBPA. Acute myeloid leukemia with myelodysplasia related changes, therapy, related myeloid neoplasm. Acute myeloid leukemia not otherwise specified. Acute myeloid leukemia with minimal differentiation. Acute myeloid without maturation. Acute myeloid leukemia with maturation. Acute myelomonocytic leukemia. Acute monoblastic and monocytic leukemia. Acute erythroid leukemia, acute megakaryoblasttic leukemia, acute basophilic leukemia, acute panmyelosis with myelofibrosis. Myeloid sarcoma, myeloid proliferations related to Down syndrome. Transient abnormal myelopoiesis, myeloid leukemia associated with Down syndrome, and blastic plasmacytoid dendritic cell neoplasm. Then, the table 132 tract 2. So the second table of this chapter, European Leukemia and recommended standardized reporting for correlation of cytogenic cytogenetic and molecular genetic data in acute myeloid leukemia with clinical data. Data H, Doe, Herner, and all blood 115.453 and to 110. Genetic group and genetic group favorable subsets translocation A21, Q22, Q22, run X1, run X1, T1. Inversion 16, P13.1, Q22, or 2, 16, 16, P13.1, Q22, CBFB, BYH1, mutated NPM1 without FLT3 ETD, normal karyotype, mutated CEBPA, normal karyotype, intermediate, mutated NPM1 and FLT3 ETD, normal karyotype, wild type NPM1 and FLT3 ETD, normal karyotype, wild type NPN1 without FLT3 ETD, normal karyotype. Intermediate second translocation 9, 11 P22 Q23 MLT3 MLL. Cytogenic abnormality is not classified as favorable or adverse. Adverse inversion 3 Q21 Q26.3 or translocation 3.3 Q21 Q26.2 RPN1 EVE1 translocation 6.9 P23 Q34 DECNAP 214 translocation in 11 VQ23 rearranged meno 5 or del 5Q 7 abnormality 17P complex karyotype major equal 3 abnormalities. Shown EDT internal tandem duplication. The third table under the 32 track 3 molecular prognostic markers in acute myeloid leukemia, gene symbol, gene location, prognostic impact. Genes included in the World Health Organization classification ELN reporting system. An M1 mutation 5Q35.1 favorable CEBPA mutation 90Q31 point favorable FLT3 internal attendant duplication 13Q12 adverse genes encoding receptor tyrosine kinase KIT mutation 4Q12 adverse FLT3 TKT 30Q12 adverse genes encoding transcription factors RUN X1 mutation 21Q22.12 adverse wild type mutation 1 11p13 adverse genes encoding epigenetic modifiers add XXL1 mutation 20q11.21 adverse DNMT3A mutation 2p23.3 adverse isocitrate dehydrogenase mutation isocitrate dehydrogenase mutation and isocitrate dehydrogenase 2 mutation 2 2q34a 50q26.1 adverse MLL track PDT 11q23 adverse TET2 mutations 4q24 adverse deregulated genes ALK overexpression AQ22.3 adverse ERG overexpression 21q 22.3 adverse MN1 overexpression 22 Q 12.1 adverse if1 overexpression 3Q 26.2 adverse deregulated microRNAs MIR 155 overexpression Q21.3 adverse, Mir 300 3151 overexpression, AQ22.3 adverse, Mir 1808 overexpression, 1Q32.1 and IQ33.3 favorable. Abbreviation AML, acute myeloid leukemia, ELN, European Leukemia Net, ITT, internal tandem duplication, PDT, partial tandem duplication, TKD, tyrosine kinase domain, and WHO World Organization. Table 132, tract 4. Initial diagnosis, evaluation, and management of adult patients with acute myeloid leukemia history, increasing fatigue or decreased exercise tolerance, anemia, excess bleeding or bleeding from usual site, limited intravascular vascular thrombocytopenia, fever recurrent infection, monopenia, headache, vision changes, non-focal neurologic abnormality, central nervous system leukemia or early satiety splenomegaly, family history of acute myeloid leukemia, Fanconi blood or Cosman syndromes or ataxia telangiectasia, history of cancer exposure to alkylating agents, radiation, topoisomerase inhibitors, occupational exposure, radiation, benzene, petroleum products, pain, smoking, pesticide, physical examination, performance status, prognostic factor, ecchymosis, and oozing from foresight. Possible acute promyelocytic leukemia, fever and tachycardia, signs and infection, papilledema, retinal infiltrates, cranial nerve abnormality, central nervous system leukemia, poor dentition, dental abscesses, gum hypertrophy, leukemic infiltration, most common in monocytic leukemia, skin infiltration or nodules, leukemia infiltration, most common in monocytic leukemia, lymphadenopathy, splenomegaly, hepatomegaly, back pain, lower extremity weakness, spinal granulocytic sarcoma, most likely in translocation, A21 patient. Laboratory and radiologic studies, CBC with manual differential cell count, chemistry, test, electrolyte, creatinine, blood calcium, phosphorus, uric acid, hepatic enzyme, bilirubin, lacticodehydrogenase amylase, lipase, Celtic studies, prothrombin time, partial thromboplastin time, fibrinogen, D-dimer, Lyra serology, cytomegalovirus, herpes simplex virus, varicella zoster cell type and screen, immunoleucocyte typic for potential allogeneic hematopoietic stem cell transplantation, bone marrow aspirated biopsy morphology, cytogenics, flow cytometry, molecular studies for NPM1 and CEBPA mutation, FLT3E tandem, internal tandem, cryopreservation of viable leukemia cells, myocardial function, echocardiogram or scan, PA and lateral chest radiograph, placement of a central venous access device, intervention for specific patient, dental evaluation for those with poor dentition, lumbar puncture for those with symptom of central nervous system involvement, screening spine MRI for patient with back pain, lower extremity weakness, paresthesias, social work referral for patient and family psychosocial support, counseling for all patients, patient with information regarding their disease, financial counseling and support group contact. So the figure between this table and these are a figure 132 tract 1, morphology, acute myeloid leukemia cells. There is an unformed population of primitive myeloblasts with immature chromatin nucleoli in some cells and primary cytoplasmic granules. B is a leukemia myeloblast containing an hour rod. C. Promyelocytic leukemia cells with prominent cytoplasmic primary granules. The peroxidase stain show stark blue color characteristic of peroxidase in granule acute myeloid leukemia. Figure 132 track 2 flow chart for the therapy of newly diagnosed acute myeloid leukemia. For all forms of acute myeloid leukemia except acute promyelocytic leukemia, standard therapy includes a regimen based on a 7-day continuous infusion of cytarabine 100-200 mg elevated 2 per day and 3-day course of daunorubicin 60-19 mg meters per day with or without additional drugs with arubicin 12-13 mg elevated 2 per day could be used in place of daunorubicin not shown. Patients who achieve complete remission undergo post-remission consolidation therapy, including sequential courses of high-dose cytarabine autologous hematopoietic stem cell transplantation, allogeneic hematopoietic stem cell transplantation, or novel therapies based on their predicted risk of relapse. Risk stratified therapy. Patients with acute promyelocytic leukemia text for treatment usually receive tretinoin and arsenic trioxide based regimen with or without anthracycline based chemotherapy and possibly maintenance with tretinoin core binding factor internal tandem duplication. Previously diagnosis in acute myeloid leukemia. Previously untreated or refractory or relapsed. Previously untreated core binding factor acute myeloid leukemia translocation T821 or inversion 16 or translocation 1616. Either option acceptable. Induction therapy. Daunorubicin plus cytarabine based regimen. If complete remission, consolidation therapy, high dose cytarabine. Investigational molecular targeting therapy. If complete remission, investigational molecular targeted therapy. For low risk normal cytogenetics, CEBPA double mutation or NPM1 mutation without FLT3 internal tandem duplication. Either option acceptable. Induction therapy, daunorubicin plus cytarabine based regimen. If complete remission, consolidation therapy, high dose cytarabine or autologous hematopoietic stem cell transplantation. Investigational molecular targeted therapy. If complete remission, investigational molecular targeted therapy. High risk normal cytogenetics, FLT3 internal tandem duplication and or NPM1 wild type, and high risk are normal cytogenetics. Either option acceptable. Induction therapy, daunorubicin plus cytarabine based regimen. If complete remission, consolidation therapy, allogeneic hematopoietic stem cell transplantation. Investigational therapy. If complete remission, investigational therapy. The refractory or relapse. The refractory or relapses to salvage treatment, patient candidate for allogeneic hematopoietic stem cell transplantation and as suitable donor. Yes, allogeneic hematopoietic stem cell or no investigational therapy. Refractory or relapses occur refractory or relapsive. Then the fifth table, under table 132 tract 5, selected agents under study for the treatment of acute myeloid leukemia, class of drug, an example of agents in class: inhibitor of mutated protein, tyrosine kinase inhibitor, the example are dasatinib, midostaurin, quizartinib, sorafenib, isositol dehydrogenase 2 mutation inhibitor AG221, epigenetic targeting compounds, the methylating agent S110, decitabine dinucleotide, oral azacitidine, isone acetylase inhibitors, suberoxylanidine, hydroxamine acid SHHA, MS275, LBH589, inhibitors of cell proliferation, cycle inhibitors, flavopiridol 202, roscovidin SN032, farnesin transferase inhibitors R115777, SCH66336, inhibitors, cytidine CT1152, MLN 8237, 8092, A3, inhibitors of protein synthesis and degradation, aminopeptide inhibitor, tozetostat, against protein 19 antagonist, 17 allylaminogenamicin, 17 AAG, DMAG or derivatives, NET8 activating enzyme, MLN 4924, LAA inhibitors, cytotoxic compound, nucleoside analogs, chlorafenibin, troxacitabine, elacitarabine, sapacitabine. Compounds with immune-mediating mechanism, antibodies CSL362, anti-CD123, anti-CD33, SLGN33 anti-KIR, immunomodulatory, lemidopyr, interleukin 2, histamine dihydrochloride. So the fact of CR is a complete remission associated with a complete remission rate, and we can say some extension of some sigla as a CALGB, the cancer and leukemia group B, or GVHD, graft versus host disease, and ASCT, hematopoietic stem cell transplantation, or AML, acute myeloid leukemia, APL, acute promyelocytic leukemia. AIM,
Io sapevo già che questo era di sinistra.
LDH, lactate dehydrogenase, and ITD, internal tunnel duplication. So these are the fact of these authors. For now, I read before the treatment of acute myeloid leukemia of this chapter of these authors, and only the video registration wasn't made on this device. So
Come si chiamava quello di cui abbiamo mandato la lettera, Domenico?
the full video we will be on the chronic myeloid leukemia.